Hi everyone, I'm Dr. Oscar Marino, and today I'll be interviewing Dr. Thomas Wakefield, who will provide an overview of the 51st Veith Symposium and its findings.
First of all, I'd like to thank Anil Hingorani for asking me to put together this summary. The 51st Veith Symposium brought significant attention to venous disease, featuring 2.5 days of presentations and workshops organized primarily by Jose Almeida and Lo Kavnik. Key areas discussed included the pathogenesis of venous disease, pharmacotherapies, new devices, venous stents, thrombosis treatment, and innovative diagnostic techniques. Please realize that what I will be talking about is only a small snapshot of the vast array of venous knowledge that was presented, and this only scratches the surface.
But why is the Veith Symposium significant in venous disease and treatment?
The Veith Symposium is significant because it brings together leading experts to discuss and share the latest innovations, research findings, and clinical practices in venous disease, ultimately facilitating advances in treatment and diagnosis and improving patient outcomes.
Talking about the pathogenesis of venous disease, what role was presented to play by the endothelium on venous diseases?
Absolutely. Joe Raffetto talked about the glycocalyx and endothelial function. The glycocalyx mediates mechanical sensing transduction, senses changes in shear stress, acts as an electrostatic barrier, and has anticoagulant, anti-inflammatory, and anti-adhesive properties. Disruption of the glycocalyx by abnormal shear stress and low flow in veins and lymphatics leads to glycocalyx shedding and expression of adhesion molecules with leukocyte activation, and this all affects endothelial function.
Also, how have genetic approaches advanced our understanding on chronic venous diseases?
So Sarah Oneida explained that genetic studies, including gene expression studies, candidate gene approaches, and genome-wide association studies, have identified several genes such as the PIZA1 and Cas-S1 genes associated with varicose veins. These studies are pivotal in identifying potential prognostic and therapeutic targets.
Dr. Wakefield, what were the key findings about pharmacotherapy presented during the Veith Symposium?
So I'm going to highlight Monica Levitsky's presentation. She spoke about many venous and lymphatic agents and emphasized micronized purified flavonoid fraction, or MPFF. This agent has been shown to improve healing rates in patients with PTS and venous ulcers, showing approximately a 61% healing rate at 6 months compared to a 48% healing rate in control patients. It also reduced the median time to healing and demonstrated greater efficacy compared to control treatments.
Can you elaborate a little bit more on how does MPFF impact the healing process of venous ulcers and PTS?
MPFF enhances the healing process by increasing healing rates, decreasing the median time to healing, and offering approximately a 38 to 40% greater relative hazard ratio increase for healing compared to control treatments, again emphasized by Monica Levitsky. This is primarily due to its anti-inflammatory effects.
One of the most interesting clinical trials presented was the VEIN platform trial. Can you tell us more about this?
Yes, this was presented by Sarah Oneida and Alan Davies. The VEIN platform trial aims to improve outcomes in venous leg ulceration treatment through a multi-arm, multi-stage trial format. These trials facilitate international collaboration, maximize recruitment, and offer financial efficiencies. They also allow for simultaneous testing of multiple interventions, efficient use of resources, and potentially quicker dissemination of results, making them more efficient and cost-effective. This is very similar to the platform trials that were used during the early parts of the COVID era.
Now, moving into new devices, what were some of the new devices highlighting during this meeting?
There were many devices, many of them new, highlighted through this meeting. Steve Abramowitz presented that the Revcore thrombectomy device shows promising efficacy with a 90% thrombus removal rate over an average of 29 minutes for in-stent thrombosis, and positive clinical outcomes for clearing in-stent thrombosis, also aiding in healing venous ulceration. Jeffrey Carr presented about the Venclose Maven perforator catheter, demonstrating a 60 to 80% perforator closure rate, indicating its effectiveness in treating perforating veins. High-intensity focused ultrasound, or HIFU, and mechanical occlusion segmental chemical occlusion, MOSCA, by the Wavella device, were presented by Steve Elias. With HIFU, ultrasound data on 35 patients demonstrated closure rates of approximately 90% at 1 week, 92% at 3 months, and 100% at 6 months. Thermography showing high sensitivity and specificity with overall accuracy over 98% for detecting venous reflux was presented by Dale Mahaje. Superficial devices in clinical trials not approved yet by the FDA was presented by Lowell Kabnick, including the S-Cure clamp, the VCD device for selective closure of superficial veins, the Invera mechanical and mechanical chemical ablation catheter, and the Saludio catheter for the delivery of tumescent anesthesia. Many of these devices will be looking for FDA approval.
Another interesting area of nano devices includes stents and thrombectomy devices. Could you elaborate more about these results?
Absolutely. The 3-year results from the dedicated venous stent registries were presented, including the clot registry by David Dexter, and I'll focus on this. This study measured 2-year follow-up with the ClotTriever system in 285 patients with approximately 11% iliac vein DVT only, 68% with iliofemoral and femoral popliteal DVT combined, and 21% with isolated femoral popliteal DVT only. Flow and compressibility were found in over 90% of treated limbs, post-thrombotic syndrome in only 18 to 19%, with approximately 6% showing moderate to severe PTS. There was continued improvement in clinical symptoms and quality of life over time. Further studies comparing to anticoagulation alone are pending.
Another device mentioned was the Biofor IVC stent. What are some features and intended benefits of this device?
So Andrew Holden described the Biofor IVC stent, featuring a self-expanding single-wire sinusoidal nitinol frame and a fluoropolymer lattice aimed at improving comfortability. It seeks to address IVC conditions and is undergoing trials in the USA and internationally with FDA Breakthrough Designation Program consideration.
Now, moving to diagnostics and therapeutic techniques, artificial intelligence made a lot of noise during these meetings. What were some of the applications presented?
Glenn Jacobowitz and Giancarlo Speranza discussed using AI in point-of-care ultrasound for diagnosing DVT in the common femoral, and popliteal veins. This technique is under evaluation and may be particularly useful when standard duplex ultrasound is unavailable or indicated. It may take the place of using clinical assessment and biomarkers to rule out DVT when ultrasound is not available.
Now, what were other areas of research presented on the Veith Symposium?
So one of the nice things about the Veith Symposium is that innovative research is presented. Alberto Figueroa demonstrated that the shear rate in areas of iliac vein narrowing can be as high as seen in the arterial circulation, potentially contributing to thrombus initiation and significant thrombosis. Understanding these shear rates is critical for developing better treatment strategies for iliac vein stenosis, such as the May-Thurner compression. There was also extensive discussion about mechanisms for stent failure, and inflow issues were emphasized. A new model for evaluating balloons and stents in a rodent IVC experimental model was presented by Andrea Obi and Oscar Marino that involved the innovation of retrograde insertion of a balloon into the IVC using Seldinger technique. Using this model, sirolimus-coated balloons attenuated the venous endothelial response and attenuated diffuse intimal thickening both in non-thrombotic and thrombotic conditions.
Talking more about thrombosis, what were the key points in treating superficial and deep vein thrombosis presented?
So Andrew Obi covered the latest advances in treating superficial and DVT, including the most up-to-date trials on DOACs. DOACs are becoming increasingly used in low doses for distal DVT. They've been shown to be effective now in cancer-associated VTE, and they have demonstrated a potential to limit severe PTS, offering significant therapeutic benefits in these conditions. Peter Hankey also demonstrated that post-thrombotic syndrome is caused by fibrosis in the vein wall, and that fibrotic response may respond to either anti-proliferative agents or monocyte-specific nanoparticle agents.
Finally, Dr. Wakefield, how might the findings of the Veith Symposium shape the future of venous disease treatment?
So the findings from the Veith Symposium will likely drive more personalized and effective treatment strategies, leverage innovative technologies for better diagnosis and treatment, and foster international collaboration through advanced clinical trials, ultimately improving patient outcomes and advancing the field of venous disease. I look forward to the Venous Symposium 1 year from now in New York to see what further advances have been made from what was presented in this year's meeting and advances that will occur over the next year. Thank you very much.
One more time, thank you so much for your time, Dr. Wakefield.